Now let's talk a little bit more about those consumer calls and a couple of examples of poor customer service when somebody calls us about a referral. I know many of you track these. You keep a running log, but oftentimes I see that agencies don't. And I say, well, how many calls do you get from consumers? And they go, well, not that many. We get a lot of informational calls. And it's like, well, that's exactly what that is. So let's talk about some poor ways of handling that consumer call. And a sample of that consumer call is the 88-year-old person that picks up the phone and says, I just need to get some information about hospice. How many of you have heard those exact words? Well, the first example of poor customer service with that is what we call the data dump approach. And to be honest with you, it's one of the most common ones we hear. And I think it comes from a very good place. It's the person at the end of the phone is so enthusiastic about the services that we provide that they just want to tell the caller all about it. I can almost hear it on the other end where they're taking a deep breath and they're going to do the Hospice 101 in 4 seconds or the home care overview very quickly. But it comes across sounding like this. Well, we do. Let me tell you all about hospice care. We provide the best care. We provide CNAs. We provide chaplains. We do this, we do that. With home care, the whole data dump. Well, to be eligible for home care, you have to be homebound. You have to have a skilled need. We have nurses, we have PTs, we have OTs, and we call that the data dump approach. And it's just spitting out everything that we do. The reason why that's bad is you don't really know anything about the caller. Now, the other approach that we hear that's very common is from those of you that are very efficient at your job. So you're immediately clicking in all of the things I need to do, but it comes across as an inquisition approach. It's almost like I can feel the paper rustling or the laptop coming up, and I'm saying, what's your name? What's your date of birth? What's your address? What's your social security number? Can you tell me when your last physician appointment was? And you start getting the 40-question grilling. How many of you have had a call like that? And it's like you want to go, wait a minute, I just wanted to find out something. So an inquisition approach where sometimes we think that we're being very efficient for our company, in the long run, we're providing bad customer service for that caller. The third one is the one that I think is kind of funny. It's called the make them jump through hoops approach. But this is oftentimes what we do as well because we want to be very efficient. And we'll say, this is a professional caller. We take a referral. Well, can you fax us the H&P and a face sheet? And if you could fax us some last clinical notes, we're going to need their insurance cards. Do you have copies of their insurance cards, and can you send us that? And so when you hang up, that caller now has a job to do. And they're thinking, man, it would be much easier if I called another agency that just said thank you and took it from there. We make patients and families jump through hoops too. I've heard many calls where it is, I just need to find some information about hospice. And we immediately tell that person all of the things that they need to do now. Well, you need to go talk to your doctor. You're going to need to get an order. You're going to need to do this. And then call us back. And so now picture that 88-year-old woman. She's now got a list of things to do. Took her 3 days to get up enough of courage to call a hospice because it's a difficult call. And now she's left with things to do. Or in a home care example, it's somebody that doesn't really know much about how home care can help, but they hang up the phone and think, oh no, that just sounds like too much work. We'll just take care of that ourselves. We do a lot of mystery calls, and I keep referring to calls that we make, and we've got examples of each of these styles, so we're going to add some of that in the presentation later. It's not that they're bad people, it's just that that's the process that their agencies have had. So think through these 3 types of calls and ask yourself, is that what I just did yesterday? Did I just get a call and I did a data dump? Or do I typically immediately start trying to fill in all the blanks and get the name, the address, the social security number, and all of that? How many times do I hang up the phone and the caller now has a job to do? So these are the 3 examples of poor customer service. Now, the only way that you can turn that around and change that is to focus on the patient and the family. Focus on the caller And it sounds simple, but it's actually a fundamental change from the way most of us do business. Most of us do those last three examples of poor customer service because that's the way we've been trained. Our process has been focused around us needing to get more information, feeling like we need to give them a good understanding of what our services are from the very beginning, so that we make sure that they qualify or they know what services that we're providing. If you focus on a patient and family, the call sounds completely different.